Kia ora koutou katoa, tēnā koe Josiah, ngā mihi nui kia koe. Thanks very much for that introduction and for building it right up. I do want to acknowledge Ron, yourself, Dean, Barb, for being here today, for presenting, and of course for the enormous amount of work you put into preparing the report, which we've now received via the Minister, and feel a very strong sense of timing, but also, we now have this role in leading the stewardship of this report and of what happens next, and we do take that seriously. So I want to acknowledge my colleague Robyn Shearer, who's here, and John is here as well, and some others from the Ministry who are leading that work within the Ministry and with many of you and others in helping shape up the government response to that. And the level of commitment in our organisation from our Minister, and indeed to the highest level in the government, is you should not underestimate or doubt that. And you will all probably know that mental health and addiction is one of the government's 5 priority areas for the wellbeing budget. And Ron, you said you sat next to the Minister of Finance, or you met him on the flight on the way down. Yes, he has a challenging role, but I can say that he and the Prime Minister are deeply committed to ensuring that the response to the inquiry and beyond that, what else we need to do to address mental health and addiction in this country, it's a very serious responsibility, and the response will be serious. So thank you to Te Pou for organising today, for inviting me to speak, and I just want to share a few thoughts with you, and I want to just acknowledge first of all your mahi and the work you do. And one of the things I'm always conscious of is when we get an inquiry like this and we look at the issues that have driven it, it's very easy to say the system is broken, nothing is working. Actually, there is a lot of really good work being done every day by really good people, and I just want to acknowledge all of you in this room and beyond. And I think those of you in here and outside who have been or will be involved in the response to the events in Christchurch, both locally there in Christchurch and nationwide, because the shock and the impact is a nationwide impact, I want to acknowledge that work you have and will do, and how fundamental that is to mental health wellbeing and to addressing addiction in our country. So I want to just start by quickly rehearsing the Minister's priorities. Many of you will have heard these before, but for those, as Josiah said, I come from a public health background, so when you have a Minister of Health who says, okay, my top priorities are equity, a strong publicly funded health system, mental health and addiction, primary care and child wellbeing, it's kind of like a dream list of priorities. It's a list you wait for your whole career for. And I'm just delighted to be able to be part of delivering on those priorities. And again, this is one that is front and centre, not just of his priorities, but of the broader government priorities. So we've been developing up, and we're in the process of formalising the response to the inquiry report. And as Ron alluded to, and the Minister announced this yesterday, the people involved in doing that inside the Ministry and beyond have been deeply involved in the follow-up to the events in Christchurch, and so there is a bit of delay in the response from the government. But I do want to make a comment I'm making in many audiences that I'm speaking to at the moment, and usually they relate to the health and disability system review, because everyone is looking to that as a big thing, which it is, but the review's not going to find a magic lever behind the cupboard that we didn't know was there. It's not going to find a fully trained workforce we didn't know about. It's definitely not going to find a bucket of money that was hidden or stashed away there. And even when the government announces the response to this inquiry, when it considers and announces the response to the broader health and disability system review, hey, guess who's going to be here to deliver on whatever comes out? It's going to be us. And there is a whole lot we can and should be doing now in the current system to address the issues that were raised through the inquiry, and let's get on with it. Let's get on with it. So we should not, as Ron himself said, we should not hold back from that. And even though the formal response to the inquiry is still coming, rest assured we're not sitting around waiting, and the need to finalise the suicide prevention action plan is pressing, and we are getting on with that. We have started looking at the Mental Health Act. We are getting on with looking at what models of care might be out there, that we can leverage off to actually, in particular, address primary mental health, and I'll come back to that. So the work is underway, well underway. Quickly then around the ministry's role in that. So I've been 9 months in the role. I'm delighted to have a fantastic leadership team in place, and they all put their hand up knowing what the challenge was, but also wanting to be a part of that. And our role is, we have many aspects to it, but we're very driven by our leadership and stewardship role in the sector. And the leadership role is not a command and control role, it's a convene and collaborate role. And nowhere is that more important than in this sector. And who we convene needs to change as well. So it's not just convening health professionals or providers, it's convening consumers. In this case, it's convening people with lived experience. Tangata whāora have to be and are part of that response and part of that leadership role. Yes, there are huge expectations on us in the ministry, we feel them, but I'm sure you feel them as well, because actually we have huge ambition. We have huge ambition for how we might improve the mental health and well-being of our country, and that is what we need to hold on to. So we should feel the weight of expectation, but certainly from where I sit, I feel also very strong support from the sector that they want the ministry to succeed in its role as a sector leader and a sector steward, because without that, the rest of the system can't actually succeed. So the theme of this conference is about an agenda for change, and I'm not going to say too much about this, but I think Barbara made this really nice comment, is that we have implementation dysfunction. So we're extremely good at identifying and refining and articulating our vision and our ambition. We're not so good at delivering on that ambition and actually implementing. And this, in one respect, this comes down to that fundamental question. It's the difference between, if you ask a room full of people like this, who wants change, every hand will go up. And if you ask who wants to change, there might be fewer hands, or there'll be a lot more reticence about throwing one's hand in the air. So the challenge of change, the challenge of responding to the inquiry is our challenge, individually and collectively, to change what we do. We're up for it, and I guess you are as well. And finally, then on to, I'm trying to catch up a bit of time for your morning tea and also leave time for questions. Finally, then on to, well, what are the priorities? Well, I think the inquiry report articulates these very, very clearly, and the 10 broad areas were just talked about previously. I've identified 3 areas that I think are really fundamental to what we do next and where we focus our implementation efforts. And they all need to happen, really. And underlying that are some really fundamental principles about the way we do things, about the way we respond to Māori, about the inclusiveness and including people with lived experience in tangata whāora. So that goes without saying, and I notice in your next session you've got Brody and James talking, and I won't be able to stay, unfortunately, for that, but I will look forward to hearing what comes out of that session. I think it's fantastic you've got them contributing here. So the first priority area I think is really important is around primary mental health, and that's primary health mental health. It's not just general practice mental health. And I had the privilege last week, I think it was, of talking to the Primary Health Federation, is that what it's called? Yeah, which is a new grouping of a range of primary community organisations. And the first question I got asked was, what might we do differently? What might we do differently that would mean we're actually adding value as a collective? And I put on the table, well, why don't you guys actually get together and work together in the response to the mental health and addiction inquiry? Because a centrepiece of that is around primary and community mental health. And instead of it being a sort of a scramble for resources, and I'm saying that quite deliberately, instead of it being detailed arguments about which model's the right model, why not act collectively to really drive the change that needs to happen? Look at what models there are there, learn from them, go about delivery in a way that is learning, that is sharing, keep the focus on what it is we're trying to achieve. And if we do that, we could get change in that sector really quickly. I think there are some extremely promising models that are being trialled and piloted at the moment, and I had the privilege of visiting one in Auckland on the morning of the 15th with the Prime Minister. Of course, the afternoon of the 15th, the day changed enormously. But the Prime Minister was very engaged with looking at this model, and she was most interested. This is the primary general practice-based pilot that's been run by Pegasus, by ProCare and others, and are going to be trialled now in other areas. The names don't matter, but what was compelling about it was the impact it's having, and what the Prime Minister was interested in is how does it integrate with other workforces outside of the general practice, and how does it integrate with the range of other community services. So that was where she went first with that. The second thing, so primary mental health, the second area is we need to be much more nimble and more integrated in the way we orient our specialist services around the needs of people, and ensure that they are supporting our primary and community mental health services in different ways as well. That includes, that nimbleness needs to include how they interface with other areas of government as well, and provide access to other essential services for people living in the community with mental health and disorders and addictions. And so that includes housing, it includes employment, it includes access to peer navigators to help people in the system. So we need to think, again, it's about each of us individually looking and saying, what could we do differently? What do we need to do differently? And finally, and of course, I would identify this and emphasise this, but that whole area of prevention and the role of the wider community, the role of the range of government sectors in that area. And I can say that the discussions about the response to the inquiry are not just bounded within the Ministry of Health. So I'm a member as a public service chief executive. I'm a member of a social wellbeing board. It's chaired by Peter Hughes, the State Services Commissioner. It has my counterparts from a range of social sector agencies. And that group has taken on an oversight role across government of the implementation and the response to the mental health and addiction inquiry. So I'm optimistic that we have some things in place, some infrastructure and some commitments in place that will actually help support the change that needs to happen. And I think nowhere is this more required than in the area of suicide prevention. And again, I just want to go back, and Robyn will talk probably a little more about this, but I just want to go back and say we are not waiting, we are getting on with that bit of work, and the actions in that plan will clearly go well beyond just the health sector, health and disability sector, into other areas of government. And there is a platform, there is both a commitment and a platform and mechanism for ensuring that happens. So I think I'll stop there. Tēnā koutou katoa, thank you again for allowing me to be here.
Fantastic.